So what are the features on ultrasound that you look for? Well, you're going to start by looking at the endometrial canal, and of course you won't see an intrauterine pregnancy, but very often you may see some fluid centrally within the endometrial cavity, and this has been called a pseudogestational sac. This fluid will always be central. It will not be eccentric in location. It will not have an echogenic rim, and you will not see a double decidual sac sign. The fluid can be round or oval, as you see here, and it is not uncommon that a little bit of decidua may fragment into the endometrial canal and mimic the appearance of a yolk sac or an embryo. But in this case, although it looks like there's a little embryo here, that fluid is central. There's no surrounding echogenic rim, and here is the patient's ectopic pregnancy, and all this was a pseudogestational sac with a fragment of decidua mimicking a little embryo within the fluid. If you use color Doppler or pulse Doppler, this will have been described in another lecture, and in general we try to avoid using Doppler evaluation of the endometrium in the first trimester. But if you happen to do this, and occasionally it can be helpful if you really need to try and exclude an ectopic pregnancy, there will be no evidence of trophoblastic flow. So in this example you can see the central fluid with color flow in the myometrium, but no flow within the endometrial stripe. The diagnostic finding of an ectopic pregnancy is, of course, the presence of an extrauterine gestational sac. And this can be identified as an echogenic ring-like structure in the adnexa here next to the right ovary, containing an embryo, and here you can see an embryo of about 10 weeks gestational age. You can even see the rhombencephalon. Very often you see these much earlier, and so the little embryo will be very tiny, as you see in this case, just between the yolk sac and the echogenic trophoblastic tissue. Occasionally you can see cardiac activity. Here it's measured with the M mode, and you can see that there's a heart rate of 105 beats per minute. And you may not see the embryo, you may only see the yolk sac. But if you see an echogenic ring-like structure with a yolk sac within it, cardiac activity, or an embryo, you have 100% positive predictive value that you are looking at an ectopic pregnancy. Now, the next most likely finding, but a little bit less specific, is the presence of an extra-ovarian tubal ring. And this is, again, a ring-like structure with an echogenic rim that is separate from the ovary, but you cannot see the yolk sac or the embryo within it. The ring might or might not be vascular, and it's typically located, as you see in these two cases, between the ovary and the uterus. However, it is contralateral to the corpus luteal cyst in approximately a third of the cases, and another common place to find the tubal ring is in the cul-de-sac. As I mentioned, this is the most dependent portion of the pelvis, and so this is a common place for ectopic pregnancies to fall. So in this example, here you see the lower uterine segment, the empty endometrial stripe, and here is the echogenic tubal ring with, in fact, a little yolk sac in the cul-de-sac. When you are looking at the tubal ring, it is extremely important to optimize your technique in order to make every effort to determine whether or not there is a yolk sac or an embryo within the echogenic tubal adnexal structure. And the reason for this is that when you see simply a tubal ring, while the specificity is high, it isn't 100%. However, if you can identify the yolk sac or the embryo within the tubal ring, your positive predictive value will become 100%, and you will have 100% specificity for the diagnosis of ectopic pregnancy. So it is extremely important to do everything you can to optimize your technique. So just to review the things you can try and do, you want to again check your focal zone to make sure that it is right at the level that you're trying to interrogate or just below. You want to make sure you're using the highest possible frequency transducer, which will improve your resolution, and you want to use harmonics and spatial compounding if available, because those features will also increase spatial resolution. But a very important thing to try as well is to simply magnify the image. So in this particular case of a woman who was pregnant with pelvic pain and had an empty endometrial stripe, you can see that there is an adnexal mass. It's relatively amorphous. The ovary is here. There's some hemorrhage here, a suggestion of a tubal ring and some adjacent free fluid. So certainly you're very concerned about the possibility of an ectopic pregnancy, and this would fall into that tubal ring category of high but not 100% specificity. However, when you magnify the image, you can see the echogenic tubal ring to much better advantage, and in fact you can clearly identify that there's a yolk sac within this, and this makes this examination, or it changes the impression from this examination to be highly likely or suspicious for ectopic pregnancy to an impression where you can safely say diagnostic of ectopic pregnancy. So remember, magnifying the image is a very, very important technique to help improve the specificity of your examination. As I said, it is not uncommon for the echogenic tubal ring to be surrounded by hematoma. This is another example of a patient who was pregnant. She had already had a prior tubal ligation, so we were quite concerned that in fact she likely had an ectopic pregnancy. You can see that there is no evidence of intrauterine pregnancy within the endometrial cavity, and adjacent to that right ovary you can see this echogenic tubal ring. We couldn't see a yolk sac or an embryo, but note this amorphous material surrounding it. It has a typical geographic appearance with these triangular margins or pointed margins as that hematoma interdigitates between the loops of bowel. And this is a very classic appearance of hematoma surrounding the echogenic ring of the tubal pregnancy. When you see an adnexal hematoma, as in this case, another thing that you can do that will optimize your technique and improve your visualization of the ectopic pregnancy is to use color and power Doppler, so that you see in this case when you use the color Doppler, the color clearly outlines that echogenic tubal ring, and it may increase the conspicuity of this finding within the adnexal hematoma. Now, the next most specific finding, though probably the most common finding, is the presence of an adnexal hematoma. And this is due to bleeding from the ectopic pregnancy, and the appearance can be very, very variable depending upon how recently the patient had the episode of bleeding, how often the patient has bled, and how much bleeding, of course, has occurred. So these adnexal hematomas appear complex, amorphous. The echogenicity can be very variable. The slide on your left demonstrates a relatively hypoechoic hematoma. Again, note those pointed or triangular margins. And on the right, you see a very echogenic hematoma in a patient who's had a more recent episode of bleeding from the ectopic pregnancy. These hematomas may be free within the pelvis, but also may be within the tube. And when they're within the tube, they're of course confined by the limits of the tube, and therefore will be tubular in configuration. So if you see a round-like heterogeneous structure and you're wondering if it is a hematoma, don't forget to turn 90 degrees on it, and very often you can see that it will elongate and look tubular or sausage-like in configuration, confirming that this is hematoma within the fallopian tube. The vascularity of these hematomas can be quite variable. Sometimes you don't see much vascularity at all, but if you see vascularity with a color Doppler, this of course convinces you that this is more than just bland hemorrhage. There is likely trophoblastic tissue within the hemorrhage, and can again be a useful finding to help you differentiate bland hemorrhage from a ruptured corpus luteal cyst from hemorrhage from trophoblastic tissue from an ectopic pregnancy. So color Doppler is helpful. It may not always be present in an ectopic pregnancy, but when you see it, it will help you confirm the diagnosis.